Welcome, everyone. This is Dr. Mercola, and I am joined today by Dr. Jonathan Wright, one of the pioneers in bioidentical hormone therapy, and he's really one of the most appropriate people to discuss some of the findings of what I perceive as a really exciting report in the um, conventional medical world, and that there's been a trend from the conventional experts, and specifically the U.S. Preventive Services Task Force, who recently, within the last few years, did a surprising change on preventive measures. And that's what they're assigned to address, preventive approaches. And they really reversed themselves on the indication for mammograms. And now they're really only recommending them for women over 50 unless there's some specific risk factors. And they're also eliminating the discontinuation of PSA screening in men for prostate. So that's really exciting news in the right direction because it really takes the focus off of unnecessary tests. And the reason we're on the phone today with Dr. Wright is that their most recent one, which was just announced a few days ago, is that they've changed their recommendations for hormone replacement therapy. And when I first started practicing, I was actually a paid um, speaker for the drug companies. They usually flew me around the country and actually pay me to speak to doctors about the scientific benefits and encourage them to use this form of therapy. And it made a lot of sense back at least there was a lot of support for it in the 70s and 80s. Probably never made any sense, but I was confused and fooled, and bought the bait, hook, line, and sinker, and but then as we learned more, we realized this wasn't a good approach, and I think about 10 years ago, they came up with some really good studies that wound up putting a black box on these hormone therapies. But now they're recommending that everyone discontinue what's called traditional hormone replacement therapy. And I really think this is a landmark recommendation, and it's just very exciting to see. So, in light of this landmark recommendation, I thought that Dr. Wright would really be the best person to provide this in the proper framework and perspective, because he is without a doubt one of the leaders in this area, and has really been a mentor to me in so many of these areas, especially hormone therapy, and helping me understand the proper perspective and context and how to apply it to best serve the long-term purposes. So thank you for joining us today, Dr. Wright.
Well, thank you, Dr. Mercola.
And I'm wondering if you could provide your comments on this and what your take is on this, and what your view is from this study recommendation.
Well, the part that you quoted so far is absolutely terrific. It's about time that a, quote, authority, unquote, put a suggested end to women swallowing molecules that don't belong in women's bodies. In fact, the worst offender, as many know, are the ones called progestins, which are patented takeoffs of progesterone, which a woman's ovaries, and for that matter, her adrenal glands and men's adrenal glands make. Those are what belong in the body, the progesterone molecules. The progestins are takeoffs, patented, and they've never even been found on planet Earth before they were synthesized. So, in a manner of speaking, we're taking an extraterrestrial space alien molecule and putting it into women's bodies and expecting that it will do some good. Well, I'm glad it's finally been decided it won't, and in fact, we should quit it. Now, the other part of that equation are the estrogens. Now, very fortunately, the ones that were, quote, traditionally, unquote, used, and that's only a tradition since the 1970s and 80s, as you just pointed out, were horse estrogens. Now, thank goodness, horses are from this planet. Now, on the other side of the equation, though, many of the estrogen molecules found in horses have never been found in people, specifically women, or men, for that matter. So here we can't say they're extraterrestrial or space alien estrogens. What we can say is that many of those estrogens are foreign to our species. And as one would expect, since they're not totally off-the-planet molecules, they don't cause as much trouble as the progestins do, the specific one being the medroxyprogesterone that is most of the trouble that was found in the Women's Health Initiative was traced back to.
And the brand name for that is Provera.
Provera, exactly. Thank you, Dr. Mercola. So, as I said, hooray! It's about time somebody recommended we quit using either horse estrogens, even though they're not as harmful as the Provera medroxyprogesterone, and for sure that we quit using the progesterones. But what we still haven't got to is that those are not the same as human hormones. And so I hope you're not going to go on to tell me that this task force also recommended against the use of hormones exactly identical to what are found in women's bodies, did they?
No, they actually were silent on that issue, but by implication, they suggested that was the case because they never really made a distinction between synthetic hormone and hormones derived from horses and what we typically refer to as bioidentical hormone therapy. There was no that issue was not addressed at all.
Well, that's probably the next step. As we both know, and everyone listening knows, bioidentical hormones can't be patented as individual molecules. They're from nature, so nobody can make megabucks on them. And so the only people who are out there working with them are the women who want to stay as healthy as they can for as long as they can, the doctors who work with them, and the compounding pharmacists. And not one big company is behind doing that because, well, the profit margin isn't there. That's just the way it goes. So I'm glad they were silent on that issue. I'm hoping that given the passage of enough more time, it will actually be admitted that those bioidentical, exactly identical to what belong in our body molecules, actually can do some good if used properly. And in fact, they can do much more good than harm on balance. Now, neither you nor I has ever claimed that a bioidentical hormone is totally safe. No way. Even if it is natural, belongs in the human body, water has the same qualities. It's natural, belongs in the human body, but my goodness, we can drown in that stuff. So that's why I said the bioidentical hormones, if properly used by someone who knows what they're doing with them and basically follows up for safety not only with physical exams but with biochemical tests which are needed, will sooner or later be recognized as things which are on balance much better for us than they are bad. Now, as you know, and I'll shut up in a second, I promise, I've been working with those since 1982 or 1983, I forget which, and the women who have been using them the longest are simply in the best shape compared to other women who haven't. And I mean the best shape in every which way you can imagine, mentally, as well as physically, as well as less cardiovascular disease, less Alzheimer's disease coming on, and something that is important, they look younger than women of the same age. Now, that doesn't mean that these things are going to prevent death. No way. That's going to happen. But at least with the use of bioidentical hormones, we can stay a lot healthier for a lot longer than we could without them.
Mm-hmm. Yeah, that's really the key. And what I neglected to mention at the beginning of this interview is that you have really, we're not going to obviously have time in this interview to discuss all the details, but you have written a very comprehensive book. In fact, really the best book I've ever read on the topic, and I've read it quite a few, and that is Stay Sexy and Young. Is that the correct title?
Oh, the publisher decided to put on Stay Young and Sexy with Bioidentical Hormones.
Oh, Stay Young and Sexy with, okay, that's the name. But if you
Yeah.
go ahead.
My co-author, Dr. Lane Leonard, and I had decided to insist on a subscript that says the science explained, because that's really the point. It's explained in simple English that even I can understand.
Yeah, it really is brilliant. And if anyone has an interest in this area and wants to know more details, because there's a lot of details that go behind these statements that are summarized that you just briefly reviewed, that this is the book to get, and it's just like about $10. You can get it on Amazon. It's just a phenomenal resource, and I think it really should be in everyone's library who has any type of interest in this area. Certainly, any clinician who's taking care of women.
Well, thank you.
And so that's a strong recommendation. And the other point on this specific study, though, that at least the Preventive Tax Service's new recommendation is that they sort of had an exclusion subgroup, which is the women who had surgically removed ovaries and were prematurely menopausal, and they felt that this subgroup might have been useful. So, of course, we know that that probably is some benefit to getting the natural estrogens from, even though they're from horses, but the likelihood of the synthetic progesterone is probably not a good idea. But the but that specific subgroup is clearly going to benefit even more. So if you're prematurely surgically menopausal, then that's even you're going to degenerate much more rapidly because your body is expecting these hormones up to a certain age, and if you don't provide it, you're going to decline much more rapidly than you would have.
Well, let's go right back to some research published a couple of decades ago in which women who had had their ovaries and uteri removed because of severe endometriosis and a few other similar problems that caused them to have them removed. I should have said those women were in their 20s. I'm sorry, I left that out. By the time those women got to their 40s, they were having as many heart attacks as men.
Mm-hmm.
They had just as much cardiovascular disease as men. Those are the women who were not given replacement hormones of any sort, whether they were these horse hormones or the patentable progestin. They were just left alone, which was really foolish, and that just underlines the statement you just made. If someone is surgically forced to go without their ovaries and uterus, oh, absolutely they should be on hormones. But of course, my interpretation of all the scientific literature, and I have read a bunch of it, and my observation is they should be using bioidentical hormones because those are exactly identical to what were removed.
Yes, and for those listening who are not aware of it, you're really the physician who introduced the bioidentical hormone therapy into the United States. You're sort of the pioneer in that area in the United States. So
we'll introduce the combination of hormones that should make up bioidentical hormone therapy because, of course, for women, ovaries make primarily estrogen, progesterone. But my goodness, when a woman gets to the need, and a man too, to the time, I should say, I misspoke, to the time when hormones might be required, why, the DHEA from the adrenal glands has gone down. The thyroid has often gone down, not always. So we need to use all of these hormones. They all work together in our bodies. So, yeah, I was the first to put all that together with a lot of help from a compounding pharmacist from Vancouver, British Columbia, because he was the only one that could supply all the materials. And his name is Ed Thorpe, and he's from Cripps Pharmacy in Vancouver, British Columbia. Thank you, Ed. It wouldn't have been possible unless you'd found the materials for the women I was working with. I should say, though, Joe, that even though I might have been the first to introduce an overall pattern of bioidentical hormones into practice in the United States, you probably know from reading the book that Dr. Leonard and I did that actually bioidentical hormones were used in China in the 11th century.
That's right. It's a fascinating story. I don't know if we have time for it here, but it's just it really just reading that or listening to you tell the story is a very powerful motivation to seriously consider applying bioidentical hormone for yourself.
Oh, absolutely. I hate to brag on my wife, but she started using them at menopause 20 years ago. And she's now 72. And when she asks for her senior citizen discount, everybody forces her to get out her driver's license.
So the reverse carding effect.
Reverse carding. The average guess is 50 to 55.
Well, that is just terrific. Now, I just want to highlight one of the, I agree with, of course, everything you said, but those who may not be familiar with the topic, some of the items you mentioned may just flip right past them, but do want to emphasize the importance of doing this with a knowledgeable healthcare clinician. This is not, even though we're both strongly recommending and encouraging people to consider this who it's targeted to, but it needs to be done with a professional, someone who understands this topic, because it's easy to make a mistake, and it's you could actually make yourself worse if you're not. So the first step, I think, is to read your book. I mean, so you have a good understanding, and you can knowledgeably discuss this with any healthcare professional, because there's a good chance after you read the book and understand it, you'll be more knowledgeable than well over 90%, maybe 95% of the physicians on this topic, because it's that good of a review. But once you do, you need to have someone who can monitor that with appropriate therapy. And there's a number of different ways to do that. You, Dr. Wright, you have a lab yourself that work with a lab that that does this through the urine. There are other companies that do it through the saliva, and there are other companies that do urine, saliva, and blood. Or so there's a number of ways that you can do this, but you really have to have someone who can review this competently and have some type of objective third-party feedback to make sure that you're doing the right therapy. Because if you're taking the wrong doses, you could definitely cause more problems than you're solving.
That's for sure. Now, the best way of doing that right now, as far as I can tell, is to go to the website for the American College for Advanced Medicine and look for someone in your area. Their Find a Doctor function also includes the areas in which those doctors work, such as bioidentical hormone therapy, intravenous therapy, whatever it may be, allergy. The other website is the naturopathic website for the American Association of Naturopathic Physicians. Now, because naturopaths are not licensed in all 50 states, there are only some of those states where they can use bioidentical hormones. But they tell you that too, and the ones who do are much more likely to be familiar than the ones who are neither on the naturopathic website or the American College of Advanced Medicine. Now, there's something coming that you probably are aware of, Dr. Mercola, and that is Suzanne Somers, who, as you know, has done more to make millions of women aware of bioidentical hormones than anyone else, is getting a website together, which she mentions in her new book called, what's it called?
Bombshell? Bombshell, yeah. Is that book out yet?
Yes, it is. Just
Okay.
came out 2 weeks ago, and I think it's now #1 on the New York Times bestseller list.
No, that's great.
She mentions a website in that book. It's called foreverhealth.com, where sometime in the next, who knows, few months to a year, there's going to be a listing of physicians who are qualified in bioidentical hormones. But that hasn't happened yet. So I just keep that in mind, and in the meantime, use those other two websites.
That's terrific. Yeah. So it's emerging. I'm just so happy to see that finally we're making a dent, that the conventional physicians are starting to wake up and realize that there was serious problems with what appeared to be a reasonable and rational approach, but when they looked at it more carefully and objectively, it didn't pan out like they thought it would. So they turned their course, which is certainly admirable and actually somewhat surprising. I'm really delighted and surprised at the same time, but I think it's definitely a sign of that we're moving in the right direction and we're making a dent. So we got a lot further to go, but it's certainly a start.
Yes, it is, and I'm very happy that they did that too. Too bad they were silent about the bioidentical hormones, but again, progress comes slowly.
Mm-hmm. Yeah, so it's they've unfortunately they've damaged some women from this, but there's the key thing is that you could there's certainly further support for this approach, and that you can take control of your health. You just have to understand that this is an issue and then get yourself educated. And fortunately, the resources exist. Your book, as I mentioned, is clearly one of the finest out there to really understand the details, and it's very comprehensive. Many people send me books to review, and there's not many that I find compelling because it just seems like it's a review of old information. But yours really stands head and shoulders above most that I'm given. It's such a compelling read, and it provides such a comprehensive review of such an important topic. So
Well, thank
I.
you so much, Dr. Mercola. Could I mention, if we have time,
Mhm.
just one aspect that is covered in the book, so I'll try to be brief, and that is the risk reduction that we all can look forward to if we use bioidentical hormones, either after menopause or when men get to the point where their testosterone drops low. The risk reduction in Alzheimer's and cognitive decline that those hormones bring is very, very, very significant. There is both observational evidence, such as the observation that women who have the highest estrogen levels in their early 60s are least likely to have Alzheimer's. I didn't say not at all likely. I said least likely when they get to the appropriate age. There is the Princeton Men's Study, which showed the same thing, that men whose free testosterone was highest at a certain age, they were least likely, again, not totally zero, but were least likely to get Alzheimer's when they were older. That's observational, so what does it prove? But then we go to the Rockefeller University studies where neurons from both male and female, cultured separately, were cultured with everything that a neuron needs to stay alive, but no hormone was put in there. And what they had observed was the accumulation of intracellular debris that is known, well known, to be involved in Alzheimer's, beta amyloid, tau protein, neurofibrillary tangle, all those things, accumulated at a certain rate in both the male neurons and female neurons. But when they introduced what they called a physiologic quantity, what does physiologic mean? It means the amount that's supposed to be around that cell, no more, no less, just a normal amount of testosterone to where the male neurons were, and estradiol, which is one of the major estrogens, to where the female neurons were. The rate of accumulation of that intracellular garbage slowed down dramatically. In fact, it went down to something like 15, 20%, something like that, of what it was before. And they even, and I think this is covered in the book, so I'll shut up about it now, but they even figured out the mechanism of action of how that helps, how that works. So there's some direct observation that we accumulate the intracellular garbage in our brains a lot less with the bioidentical, exactly to natural hormones. And if there's any reason we all should be considering bioidentical hormones, is to keep all our marbles.
Yeah.
Look at how many people are getting Alzheimer's these
Yeah,
days.
it's definitely an epidemic, and it's getting worse. It's not getting better. But before we sign off, there's another important topic in the book that I'd like you to review because you do it so eloquently, and it's really, and I just want to give a little history of my experience with hormone therapy, and I became very enthralled with it in the mid 90s when Dr. Lee was around, and he really popularized the sort of the lay approach of natural progesterone therapy, which was and still today used by many women topically, that's applied to the skin. And my experience with that in the 90s was really phenomenal. I thought it was nothing less than miraculous, and I see so many women get better with. But then what I've observed was a paradox that that improvements started to disappear over time, and so I became less enthralled with it, and eventually discontinued using it or recommending it in women, even though I think he was onto the right component. And I sort of abandoned bioidentical hormone therapy for a number of years until we had a discussion a while ago, and you very simply explained that was due to the method of administration, because you can swallow them, you can apply them topically, or you can apply them transmucosally. So I'm wondering if you could, because to me that's one of the most important messages in the book, because even once you're convinced of the value of bioidentical over traditionally used ones, and you're motivated to use it and find an experienced clinician, if you're given the wrong type of dosage regimen with respect to the way it's administered, you can get yourself messed up. So I mean, you really got the devil's in the details, and it certainly is true for this particular topic.
You bet. Well, briefly, if we're ladies, our ovaries are not sewn into our intestines. Now, what does that mean? What it means is that if they were, the hormones would go straight from the gut to the liver and the liver would operate on them. But no, 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 no. The ovaries don't release the hormones straight into the gut to the liver. The ovaries release them into the bloodstream, which goes straight to the heart. And the heart distributes the blood with the hormones all over the body, and then a little tiny bit of that goes by the liver every passage of blood, and so it's a little is taken out, a little is taken out, a little is taken out. Same goes for guys. The testosterone goes into the bloodstream, not straight to the liver, and it's distributed all over the body before the liver gets a chance at it. Now, if we swallow those hormones, they go to the gut, and they go straight to the liver, and the liver's job is to get rid of them, to detoxify them, it's called. What that illustrates is a principle that both you and I follow, Dr. Mercola. It's called copy nature.
Mm-hmm.
How does nature do it? And if we do it the way nature does it, or as close as we possibly can, we're most likely to get the job done with the least harm. So, rubbing them in gets it into the bloodstream to the heart and all of the body. But what you observed was what I had also observed between the early 1980s and first woman, because it was mostly women working with bioidenticals back then. The first woman who came back and said, hey, this isn't working so good anymore, was probably 1984, 1985, after 2 or 3 years, and then there were a few more. So fortunately, we had the lab available, and we could compare the same dose in the same woman, the levels on her lab tests were getting lower and lower and lower. And why would that be? Because we were using the same dose when we checked with the pharmacy, but that's what was happening. So since I'd observed that, but I knew this stuff ought to work, I asked one woman to switch where she rubbed it in from skin. And by the way, she had been rotating sites all over the body. I asked her to switch it to a mucous membrane. Now, mucous membranes are kind of like lips and inside the nose, but also in the pelvic area there are mucous membranes, and for ladies, it's inside the labia and the vaginal area. And very fortunately, the quantity of carrier that was used for the estrogen, the compounding pharmacy had made it a small quantity, so she could rub it into the labia or into the vaginal area, and it didn't come out and make a mess on her clothes, which is the big objection if you're using a whole lot of carrier. And this same woman, using the same doses, switched from skin to, in fact, it was even the same prescription. It wasn't even a newly compounded prescription. Switched from skin to rubbing it into the mucous membranes, and we did the follow-up test, and bang, it went all the way up to where it was the very first time she'd been tested after she started hormones. And she says, I feel better. I said, well, yeah, I expect so. Look at your numbers there. And the same thing happens with guys. If guys rub the stuff into the skin, it'll work for a while, no question. So use it for as long as it works. But sooner or later, with most women and most men, it just quits working as well, and we have to switch it to that mucous membrane, and that's what's meant by transmucosal. And for guys, the only mucous membrane we've got in the whole pelvic area is right where we would grow a hemorrhoid if we were going to grow a hemorrhoid. It's called technically, if we want to be technical, the perianal mucosa, but it's very thin back there, and anybody who's been 3 years old and checked around their bodies knows that the skin outside the anal opening is not really skin. It's a thin kind of membranous thing, sort of feels like a lip or something there, and then it fades into skin, or phases into skin. So for guys, rubbing in there, it just keeps working and working and working. And that's why you got to work with a doctor who knows where the compounding pharmacy is, who can put the most hormone in the least carrier volume, because that way it absorbs and doesn't get all over our underclothing.
Yeah, and the other point that you just kind of skipped over because of the time issue is that you clearly want to get it into the blood, but it's where in the blood that it first enters, because you can swallow it. You could put it anywhere, with topically, but or even sublingually, which I'd like you to address too. But the fact that you're putting the pelvic area is where initially the hormones naturally first enter the bloodstream. So you're replicating nature even at a higher level.
Well, we're coming as close as we can. We obviously can't take a needle and stick it up into the testicles or the ovaries to let it be released, but we're coming as close as we possibly can, which is important. And getting over to sublingual, Yeah, some of that absorbs into the bloodstream and goes to the heart, but studies have shown time after time that when we put something sublingual, at least half of it is swallowed, goes down to the gut and off to the liver. Oh, and guys, especially, don't do that, because what we find on follow-up tests, when guys put their estrogen either swallowed or sublingually, too much of it comes out as estrone.
Yeah.
Guys start having high estrogens, and that's because of what the liver does to it.
Now, what's the current status on topical progesterone? Can that still be purchased over the counter, or has the FDA started to crack down on that?
No. One can still purchase topical progesterone. That's the only one. One cannot get topical testosterone over the counter, that is, or estrogen or DHEA, but one can still get topical progesterone.
But can't you buy DHEA orally over the counter?
Yes, and that's a very bad idea because that's the worst offender at turning into estrone, which is one of the major estrogens for guys. Guys swallow the stuff. Let me turn that around. Guy comes in, he's got his test that shows his different estrogens as well as his testosterones, and the estrogen's high. And I'll ask him, are you swallowing DHEA? And about 9 times out of 10, oh yeah, I am.
Yeah, and there's good, compelling evidence to suggest supplementing DHEA. They're just doing it in a way that's going to cause them far more harm than good.
Well, and us guys don't need too much estrogen, that's for darn sure.
Yeah. So, and I'm grateful to you because I did a consultation with you a number of years back, and you indicated that I was low and it could benefit from some DHA after analyzing my results. And I've been on it for a few years now, and really take a very small amount transmucosally, and it's just done amazing things to normalize my hormone levels. So I'm grateful that you helped encourage me in that direction. So, but the key point here is don't swallow this stuff because, you really may have loads of problems that you're not anticipating.
Yeah, and the longer we swallow it, the more those problems might come up. So it's got to be rubbed in, and transmucosal is best. I know that some folks are thinking, oh, do I have to? I'll tell them, look, rub it on your skin, but make sure you get your test done at whatever interval your doctor says, and whenever it starts to drop, you're going to have to switch then.
All right. Well, I thank you for taking time out of your busy schedule to review this. We could be discussing this topic for days because you actually teach a 3-day, is it 3-day courses? 3-day course for physicians to certify them in this?
I teach in a 3-day course. Yes,
yeah.
I don't do the whole thing now.
So you're right, but there's a 3-day course that physicians take to get certified in understanding this, and of course, you need practical experience. But there's a lot of information here. But your book does a phenomenal way of really explaining it at a level that most people would find it not easy, but certainly understandable. It may take a little review of some of the chapters, but it's really, if you're interested in this topic, I couldn't recommend it more highly. So thank you for compiling that. Thank you for being a resource and a pioneer, and for really helping people understand how to optimize the best way that they can take control of their health with natural therapies.
Well, thank you so much for getting this word out, Dr. Mercola. What you've done to get the word out with your website, wow. We all admire it.
Well, you're welcome. You're most welcome. It's a great honor and privilege to be able to help people in this area.
You bet.